Three, two, one. What is happening, everybody? Dr. Z here for ZuluTime episode number 149. And today we're going to be talking about Diabetes Secret Series. And the main thing today, we're going to be talking about the complications of the heart, the brain, and the legs. And these are the complications due to the big vessels of diabetes. And so diabetes is the leading cause of death by stroke, the leading cause of heart attacks, the leading cause of stroke, and so pretty big deal. You are 150 to 400% more likely to have a stroke if you have diabetes. So definitely pretty crazy numbers to watch. And so the main thing is, how does the vessels or the big blood vessels get damaged? Well, this is called atherosclerosis. And so what happens is that the sugar starts, the diabetes has increased atherosclerosis, meaning that there is the sugar through the blood starts accumulating in the walls of the vessels, right? And then through inflammation, it kind of rips a little bit of the vessel, and then it starts creating, so then the vessel starts trying to repair it, and it sends like muscle cells, and then it starts forming like this clump of muscle cells, inflammation cells, and this is called the atheroma. And so usually that doesn't cause blockage per se, but then when this thing called the atheroma explodes, then that's when you actually have the blockage of the vessel. That's when you end up with a heart attack, and then that's when you end up with the leg pain, or that's when you end up with the stroke. And so that's kind of how it happens. Is really when the accumulation of all of these cells and inflammation gets so big in the vessel that it explodes, and then that's what clogs up the arteries. And so that's atherosclerosis. So atherosclerosis can happen mainly in the heart, in the brain, and in the legs. So in the heart, how does it happen? Well, the same process happens in the vessels that actually fuel the heart itself. So as a little concept to understand is that the heart pumps blood throughout the whole body, right? So that the body has energy to be able to function, but also the heart needs energy too. So how does it get its fuel? Well, it has like these little vessels that actually supply the heart itself with blood. It is actually the first organ to be supplied with blood. I think it's a great little lesson from the heart, because it's like, if we don't take care of ourselves first, kind of like in the airplane, if you gotta put the mask first, then take care of others, right? So it's the same with the heart. The heart feeds itself first, and then it feeds the other organs. And so then this process happens in the heart, it clogs the arteries, and then you end up with a heart attack. And so what happens is that the artery gets clogged, and then the muscle farther away that was initially supplied by that vessel starts dying. And so that death of that muscle, that's what a heart attack is. And about 68% of diabetic patients that are 65 or older will die of a heart attack. Pretty crazy numbers, right? And the crazy thing is that death by non-diabetic heart disease has improved, and it's decreased by like almost 36%. So, but people who have diabetes, this has not improved. It feels like, it's so crazy. This problem keeps getting bigger and bigger and bigger and bigger. And is because the foundational understanding of this disease has not been explained well or engraved well into the public. So then let's talk about the stroke. So what happens in the brain is the same thing, right? So the vessel starts getting inflammation, then there's damage, then there's like muscle cells that go try to repair it, then it clogs up, then it forms this atheroma, which is just a clump of all of that, then this thing explodes. Then you get blockage of one of the arteries to the brain, and it's like losing like a few hose to a motor, right? Like there is no more fuel, and so that part of the brain dies right away, and then you end up with a stroke. It's a huge disability contributor to disability around the world. And just having diabetes increases your chances of having a stroke by from 150 to 400% about that if you have diabetes, which is pretty crazy. And then the last thing that I want to talk about is the legs, right? So what happens to the legs? The same process happens in the legs. This starts clogging up, the inflammation damages the vessel, then you end up with this atheroma, or this clump of muscles and inflammation, and then this explodes and it blocks the arteries, and then you end up with like a heart attack in the leg. And what happens is that people's legs start falling off literally, and so this is like what is called gangrene, and that's why many diabetics have to be amputated, about 4%. So if you know 100 people with diabetes, 4 of them will need an amputation. So pretty crazy to numbers. And so I think that's it for today. So remember, diabetes really is the sugar running through the whole body, and it affects the whole body, small vessels and big vessels. The big vessels are mainly affecting the brain, the heart, and the legs, and that's what we talked about today. In the heart, you get a heart attack. In the brain, you get a stroke. In the legs, you get like gangrene, right? And so that's what happens and then in the next episode we're going to be talking about Alzheimer's. We're going to talk about skin. We're going to be talking about other things that diabetes affects. And so stay tuned, because that's an awesome episode. And that's it for today. Until next time, Dr. Z here, and remember, take it easy.